Good morning everyone. Today we are going to see about another chapter in dermatology. Here we are going to discuss about first roseola. Roseola is a condition which is caused by human herpes virus 6. So the most common presentation is they will be presenting with a high grade fever 103 to 104 degrees for 2 to 3 days, and the fever will abruptly subside followed by a rash. This is more commonly seen in infants less than 2 years old. So this is about roseola. The next condition is Pityriasis roseae. Even though the names are almost similar, they are totally different conditions. Pityriasis roseae, here there will be something known as a herald patch, which is that there will be a larger patch. Even though there are smaller patches, there will be a large pink elliptical lesion which is seen in Pityriasis roseae. This pattern of distribution will be Christmas tree pattern of distribution, which is seen on the back as well as on the trunk. Kaposi sarcoma. Kaposi sarcoma is a condition which is caused by human herpes virus 8. Human herpes virus 6 causes roseola. Here it is Kaposi sarcoma is mostly seen in immunocompromised, not mostly, almost always seen in immunocompromised patients like AIDS or chemotherapy. They will be presenting with violaceous tumorous lesions. The Kaposi sarcoma will present as Bacillary angiomatosis, but Kaposi sarcoma is caused by the virus, isn't it? A similar picture, Kaposi sarcoma like vascular lesions, but caused by bacteria is another condition where the causative agent is Bartonella henslae. Here this occurs in immunocompromised state similar to Kaposi's, but this is due to cat exposure. So the same agent which causes cat scratch disease, that is a Bartonella henslae, is the one which results in Bacillary angiomatosis. Here when the cat, in normal patients who are not immunocompromised, they will be having, due to a cat scratch disease or due to entry of the Bartonella henslae, there will be small papule at the scratch. But in immunocompromised patients, it will present with Bacillary angiomatosis serving as a DD for Kaposi sarcoma. What about reactive arthritis? Reactive arthritis is also known as Ritter syndrome. It is in association with it can be seen in association with the PAR spectrum like psoriasis, arthritis, inflammation, and rheumatological conditions. So this occurs secondary to any infection. That is why the name reactive arthritis. So this is about the cat scratch disease, which I told you, which can happen even in individuals with a healthy immune system, where it will present only as papules on the hand at inoculation site, can be associated with regional lymph node enlargement. Let's see about molluscum contagiosum. Molluscum contagiosum is due to pox virus. It is the largest DNA virus. Here there will be skin colored reddish papules with central umbilication. This the most frequent agent that causes molluscum contagiosum is because the virus stays in fomites, that is inanimate objects which can hold the virus and transmit to people. Say for example in pool railings, in shared towels, this can result in molluscum contagiosum. This knowledge can be tested in exams, like they might give you in a weeknet telling you that a person who has decently went to a pool party and after a couple of days is presenting with lesions, reddish papules with central umbilication. This is molluscum contagiosum. It is common in children and seen in immunocompromised patients. What about onchocerciasis? Onchocerciasis is the second most common reason for blindness worldwide. First most common cause of blindness is trachoma. Second most common is onchocerciasis. Here it is caused by this fly, where the fly injects the nematode, or that is a helminthic roundworm, which is 1 millimeter in size, into the patient, which causes onchocerciasis. So even though it is the second most common cause of blindness, it can be easily treated with the humble drug ivermectin. Chagas disease. Chagas disease is caused by Trypanosoma cruzi and the vector is the reduvit bug. So here the reduvit bug will mostly the patient would have gone for hiking or some outdoor activities, and the bug would have and they would have been bit by the bug. This bug is also known as kissing bug because the way the bug bites, it will not be painful at all. It will be so painless, almost as if the bug is just kisses the person. That's why it is known as reduvit bug, and it transmits the protozoa Trypanosoma cruzi into the patient's body. The classic sign is characteristic swollen eyebrow, also or else the eyelid, which is also known as Romano sign, which is characteristic for Chagas disease, and it can present with dilated cardiomyopathy. So the vignette will be something like they are having a shortness of breath after a recent hike. So in that case, it should be obvious that the shortness of breath is due to dilated cardiomyopathy. Any person who has been that sick with shortness of breath wouldn't have gone to a hike at all in the first place. And since it has occurred after a hike or after an outdoor activity, so it is that is a very good pointer to remind us about the Chagas disease. This can also present with the GI issues, but that is not very imminent or significant or impending. Therefore, this is the one which can help us to identify the Chagas disease. What about the Leishmaniasis? Leishmaniac ulcer will present like this. It can present with an ulcer cutaneous lesion, or it can present with a visceral lesion which is known as Kala azar, where there will be where it can attack the liver, resulting in elevated liver enzymes, as well as the bone marrow, resulting in pancytopenia. What about Mycobacterium marinum? Mycobacterium marinum is the infection which can occur. It is similar to all Mycobacterium. It is also an acid-fast bacilli on the microscopy. So here this infection occurs in aquarium or in marine environment contact, and they will be presenting with red ulcer or blisters on the exposed extremities. A similar organism is Mycobacterium avium intracellularae, where this is presenting in immunocompromised patients, also in immunocompetent. In immunocompromised, it will be presenting as a preauricular reddish lesions. So this idea or this concept can be given to you like a patient following a renal transplant has a preauricular reddish lesion. In that case, it is due to Mycobacterium avium intracellularae. But in older women, it can present as Lady Windermere syndrome, where they will be having a respiratory difficulty following Mycobacterium avium intracellularae. Chronic lung infection with bronchiectasis or respiratory difficulty or any kind of lung infection can present with Mycobacterium avium intracellularae. So the two most common presentation is preauricular preauricular reddish lesions, as well as lung infection called as Lady Windermere syndrome in older women. This is with respect to Mycobacterium avium intracellularae. Visceral leishmaniasis. This is what we previously saw in the cutaneous leishmaniasis, where they will be presenting with an ulcer. Visceral leishmaniasis is that where it splits to organs, thereby having an elevated LFT, or with the bone marrow, which is resulting in a pancytopenia because it suppresses the hematopoiesis. Leishmaniasis is transmitted by sandfly. The protozoal parasite will infect the macrophages in the body. So this is another thing which you should know about leishmaniasis. What about leprosy or Hansen's disease? It is caused by Mycobacterium leprae. It is temperature sensitive. That is, it grows at a colder temperature. Then peripheral neuropathy, presence with peripheral neuropathy, where they will tell you like the patient is having hypoesthesia to pain or temperature. Sometimes in advanced cases, it can also present with leonine facies, as well as the bones which are affecting the phalangeal joints, there be the digits are all become malformed. What is dermatitis herpetiformis? Dermatitis herpetiformis is seen in celiac disease. Here there is IgA deposition which is seen at the dermal papilla in extensor surfaces like the elbows or else the knees. It will be intensely pruritic and papillovesicular eruption similar to this. So celiac disease can be prevented by a gluten-free diet. Similarly, dermatitis herpetiformis can also be treated with a gluten-free diet. If it is not, if the gluten-free diet doesn't cure dermatitis herpetiformis, then dapsone can also be tried. A little bit in detail about the pathogenesis of dermatitis herpetiformis. Here, it triggers the immune response in celiac patients. The IgA, what triggers the gluten? So the IgA antibodies form against the gluten as well as the tissue proteins. These IgA antibodies will enter the bloodstream and the IgA antibody deposits at the dermoepidermal junction, resulting in the pathogenesis of dermatitis herpetiformis. What about pyoderma gangrenosum? Pyoderma gangrenosum is a skin manifestation of ulcerative colitis. Just like how we have a skin manifestation of celiac disease presenting as dermatitis herpetiformis, ulcerative colitis presents with pyoderma gangrenosum. Erythema nodosum is a skin manifestation of sarcoidosis. In sarcoidosis, there is painful red nodules on the shin. This is because I will tell you in detail about it. So this vignette, that is the idea of erythema nodosum, will be asked to you like a patient is having non-caseating granulomas in the lung, and they can also give you like an African origin, a middle-aged woman, and she presents to you with painful red nodules on the shins. What is the nodule? The nodule is nothing but erythema nodosum. The nodule occurs because of inflammation of the subcutaneous fat. That is the reason of this of the erythema nodosum. It can also occur in any other inflammatory bowel disease. Can also occur due to sulfa drugs or streptococcal infection, but most commonly it is seen in sarcoidosis and IBD.